I'm gonna record an updated version. So yeah, moving along here. Maybe. There we go. So a little bit about the Medicare program that I work for. So I work for a program called SHICK. Yeah, you have to be careful how you say that. It stands for Senior Health Insurance Counseling for Kansas. So what that means is, as a SHICK counselor, I've had to go through extensive training, both online and in person, with Medicare and the Kansas Department of Aging and Disability Services. And I have to maintain that status, I have to go through update training every year to keep that status going. Of course, Medicare has done background check on me, so I guess I'm okay if I'm still doing this. So I do not get any compensation, let me try and say that correctly, for doing this as a SHICK volunteer. Now, since I do work for Kansas State University Extension, of course, I get paid by them, but that is strictly tax dollars that are paid into my salary. So I'm truly your tax dollars at work for you. So, and then of course, tonight, my goal is to provide you with information so that you can make an informed decision about your Medicare and your health care in your retirement years. So kind of a little caveat or disclaimer, if you will, for what we're going to try to tackle tonight. So kind of for people that like to know where we're going to talk about Medicare. We'll talk about A, B, and D. And I've kind of boiled it down to two options, basically. So we'll talk about the parts of Medicare. We'll talk about what one option is that includes Medigap. And we'll talk about the second option, which is Medicare Advantage. We'll talk about what it means if you work beyond 65. And then tips and cautions. I don't have a great title for that, but it's just some of those kind of like aha things that I keep trying to make sure that people are aware of, so you don't get caught up in something you don't want to be in. We'll also touch on the extra help program, and then we'll do wrap up and questions. Whoops, sorry guys. That'll teach me to touch my mouse, right? Okay, well, what's Medicare? Medicare, of course, is a federal health insurance program. It's designed for people age 65 and older. It's also available to people under 65 if they're disabled. And then the third category is if they have end-stage renal failure or kidney failure. So those three groups of people are qualified to get Medicare. Now, Medicare has 5 different components that, and how they cover different services we'll talk about. But be sure and note that, you know, what works best for you is maybe not what works best for your neighbor or your cousin twice removed, you know. So everybody's health is different. And some people choose to get insurance in other manners and other ways, and that's fine. They have to do what's best for them. So keep that in mind. So the big question I always get is, do I have to enroll in Medicare? Well, it's kind of like, it depends. So yes, if you plan to stop working at 65, yes, you'll want to enroll in Medicare. If you are on the Affordable Care Act, what we used to commonly call Obamacare or marketplace insurance, that will automatically end at age 65. So you have to go on to Medicare then, or if you're disabled. So those are the 3 things. Are you guys hearing me okay?
Yes.
Okay, so those are the 3 things for Medicare. Now the other part is, no, you don't have to enroll in Medicare when you're 65. So if you're working beyond 65 and you want to keep your employer coverage, you do not have to pick up Medicare at that time. Everybody's always worried about the penalty side of Medicare, but there are some things that you can do to prevent from incurring that penalty. And we'll talk about that down the road. Especially for people on employer coverage, you may not want to, pick up Medicare, or maybe only pick up A, and we'll talk a little bit more about that as we go. So the 4 parts of Medicare, Part A is hospital. So that's, your hospital coverage. Part B is like your doctor coverage or outpatient coverage. So if you have to go get a colonoscopy, or you need some sort of like shot or infusion, that would be covered under Part B. Part C is kind of highlighted there. It's kind of its own special thing, and we'll talk about that down the road, but it kind of is like a combination of everything kind of all rolled up into one package. And then Part D, of course, is drug coverage. So we'll talk about that too. So things that are typically not covered by Medicare A and B are like eye exams, hearing aids, dental care, that sort of thing. So, that's one thing that under employer coverage, we've been really spoiled that we've had access to those kinds of coverage. Currently, they're discussing whether or not to add it into Medicare. I don't anticipate a decision anytime soon on it. It's kind of one of those things. It's like, oh, we should do that. And they really should, in my opinion, because dental and eye and hearing, all that kind of plays into your overall health. So I hope to see it happen at some point down the road for sure. So some key dates for Medicare. So the 7-month window, the 3 months before you turn 65, your birthday month, and then the 3 months after your 65th birthday. That's when most people that are going on to Medicare at age 65 will enroll. There are some exemptions, like if you're working or covered under like a spouse's policy where you don't have to pick that up right away. Part D, prescription drug coverage, of course, open enrollment starts tomorrow, and it goes through December 7th. So you can anticipate that your TV and mailboxes will be full of all kinds of stuff regarding Part D. And then, of course, Part C, Medicare Advantage, typically that initial enrollment period for A, B, D, and or C happens, around that 7-month enrollment window. But if you wait, you can actually enroll during the fall open enrollment period. And then if you want to disenroll, you can do that after the first of the year. So I started calling this 7-month enrollment window the honeymoon period of Medicare, if there is such a thing, because that's kind of like the sweet spot for most people that are going off their employer coverage and onto Medicare. So this is just another chart talking about that same thing, so signing up the month you turn 65, and, if you delay, then that could delay when your enrollment is. And of course, if you totally miss it, then you could get a 10% penalty per year that you're not enrolled. So don't get scared yet. There are some ways to avoid that big penalty. So step 1, when you're ready to enroll in Medicare, what you do is you contact Social Security. Typically about 3 months before your birthday, or about 3 months before you're ready to separate from your employer and retire. So in Lenexa, we do have a Social Security office off of 95th Street. You can go in person there, but you have to have an appointment. You can't just walk in right now due to COVID. So there's a local number that I have listed here. It's listed again at the end of my slide deck. And that's how you would do it, if you wanted to go in and visit with someone in person. It's much easier and quicker for people to go to socialsecurity.gov. And that way you can actually, if you're a little bit, comfortable with using the internet, you can go in there, see what your benefit's going to be when you start collecting that, and then tell Social Security when you want to start your Medicare. People from railroad, retirement plan, they have to contact the railroad for their Medicare benefits. So that's their first step in getting their Medicare coverage. So A and B is often nicknamed Original Medicare. So you want to make sure that the doctors that you currently use or like to use, that they're willing to take Medicare as payment for your health needs. So that's one thing, to make sure that they will take whatever coverage you're considering going with. And also, Medicare is designed to only pay about 80% of your healthcare costs. So the other 20% that's not covered by Medicare, people will either go with like a Medigap, a supplement plan to kind of help pick up and cover those costs. Maybe the provider might write some of that off, or they may consider going with an Advantage plan to help with some of those costs. So the Part A, of course, is free. And for most people, there is kind of a sliding scale for people in the upper echelons of income. That's why this current slide is up there, because if you and your spouse make, over $174,000 a year, you could have to pay a little bit higher rate for your Part B. So be aware of that. Most people, though, probably 95% of us end up paying $148.50 a month. Excuse me. And I think I heard today that they're estimating that might creep up a couple of dollars for next year. I haven't heard that definitively yet, so but I would not be surprised to see it be about $150 a month. And how this is paid is that when you take out your Social Security benefit and they start sending you a monthly check, they will deduct the Part B premium from your check before they cut you a check and send it to you. So that's how it's paid. Now, if you're still working, or maybe you retired but you don't want to take your Social Security benefit yet, then what happens is they'll send you a bill for that every month, and then you'll have to pay for your coverage for Part B. Typically, Part B does have a deductible of $203, and then of course the 20% co-insurance for doctors and such. So this is the latest information I have now. I would not be surprised between now and the end of the year to see something adjust a little bit. It does happen, but typically this stuff is pretty much what you can expect to pay. So prescription drug coverage, of course, you want to make sure that you have credible coverage with your current employer or VA, meaning that it's as good as Medicare's. In September, your employer should have sent out or your insurance company sent out a statement stating that you do have credible coverage. So if you get that, it's worth hanging on to keep. I know I just got mine a couple weeks ago and I was like, oh, I need to hang on to these. And so, but it just stated that we had credible coverage. So if you're someone looking at Part D drug coverage and you don't take any drugs at all, you're healthy and lucky you don't have to take anything, then what's suggested is that you still go ahead and enroll in a Part D drug plan, but choose the least expensive one they have. This next year, we have one as low as $6.30 a month. So, you know, for a whole year, that's pretty cheap to have that drug coverage for Part D. But that plan may not work for everybody. So depending on what drugs you take, what pharmacy you love to go to or prefer to go to, all those things kind of enter into you know, what drug plan you should enroll in. Excuse me. Also, if you know, I've had people that I've counseled that, you know, maybe they were healthy and didn't take a drug plan for 10 years. So then the penalty ends up being 33 cents a month times, you know, all those months that they could have had a drug plan but didn't. And then if they do have that penalty, they pay that as part of their drug plan premium for the rest of their life. So it could be a few dollars, or, you know, for one lady that was in her 80s that I tried to figure this up for, she was better off not even taking a drug plan at that point because she just had a couple little generic drugs. But you know, and then she could use some other kind of social service kind of plans to kind of help cover if she needed something more extensive. But yeah, you know, it's just kind of one of those things that we usually recommend take one, even if you're very healthy. Sorry, tickle. So how do you choose a Part D drug plan? So we compare costs, the coverage, of course, and convenience. So of course, starting tomorrow, you know, every year is when you'll want to look at your drug plan. And I suggest to people to look at it every year because things do change quite a bit. Last year we had, I think it was like 30 different drug plans. And this year we're down to like 20 something. So a lot of them have stopped selling plans, or they've changed the people that are in their plan. They've moved them to a different plan, and many times that's more expensive. So it's definitely an area that you need to stay on top of and be aware of. Sorry. So how do you enroll in a Part D plan? You can call a SHICK counselor. In Johnson County, we currently have about 20 counselors, and they're kind of scattered around the county. And they can sit down and go over your meds and also see what your best option is for saving money on your prescriptions and your premium and such. You could go to Medicare.gov and use their plan finder, which is what we do as counselors. But it can be kind of difficult to navigate through that system. You could call the Kansas SHICK hotline. They are located in Wichita, manned by my coworker at the Sedgwick County Extension Office. You could call Medicare. This time of year, though, you can expect to wait online for a long time. You can call the drug plan directly or register on their website. So there's different ways to look at and enroll in your drug plan. So, you know, use whatever works best for you. I put this slide in just to kind of show how things change from year to year. Currently, people that are on Medicare drug plans, most of them do have a deductible. Currently it's $445. That's going up to $480 next year. So during that initial coverage phase, once that deductible is met, then you are in what they call an initial coverage phase. And during that time, then you do get a break on the cost of your drugs. Once you reach the out-of-pocket threshold, what we used to call the donut hole, then you pay 25% of the cost of those drugs. So then after you reach the total out-of-pocket threshold, then you fall into what we call catastrophic coverage. So, you know, for a lot of people, that's $10,000 worth of drugs. That's quite a bit. And then at the bottom of your screen, you can see that once you get into that catastrophic coverage phase, then the prices of your drugs go way down. So generics are like $3 and some change. Brand names are under 10. So, but you really have to spend a lot to get to that stage. And that's the total cost, total retail cost, so of your prescriptions. Okay. Same thing for people that have higher incomes. You will pay a little bit more for your prescription drug coverage. So for people over 176,000 for couples, you would tack on an additional $12.30 to what your basic plan premium cost is. So just pointing that out, that, you know, most people are not going to have to worry about that, but there are a few people that do. So just to be aware. So so far we've talked about A, B, and D. So now we're going to move into how that becomes your one of two options for Medicare. So option one is to have your A, hospital, your B, medical, pick up a Medicare supplement, which is also called a Medigap. So the same supplement, Medigap, means the same thing. And then pick up a Part D drug plan. And this is kind of like going to your favorite fast food restaurant, ordering a hamburger, the fry, the drink, and a dessert. You know, you order them kind of a la carte. So that's kind of what your option one is for Medicare. So some information about Medigaps or supplements. They are regulated in Kansas by the Kansas Insurance Department, and they are sold by private companies. They have to be, well, they don't have to be, but they are regulated by the state, which I think for us, that is a huge benefit. Medigaps can help control that 20% that Medicare doesn't cover. There are currently 10 policies. C and F, which are highlighted there, are not sold to new beneficiaries. They are available to people who are enrolled before January 1 of 2020. Supplements don't cover long-term care. They don't cover dental, vision, hearing, all that kind of fun stuff. So in Kansas, you choose a Medigap policy based on the premium that you can afford or want to pay, kind of thing. And I'll explain that a little bit more here. So of course, initially you have to have A and B in order to buy a Medigap, because you have to be able to give them your Medicare number. So that's why those two pieces have to be in place first. The best time to buy a Medigap is like when you're first going on to Medicare. So when or if, let's say, you've delayed going on to Medicare a few years, that's the best time to buy, when you first go on to Medicare, because a Medigap policy cannot turn you down for coverage. What else do I want to say? Sometimes if you wait, let's say you decide to do an Advantage plan for a while and then want to go to a Medigap, you would have to go through medical underwriting. And at that point in time, a Medigap plan can turn you down. So that's why buying when you're first eligible to go on to Medicare is important, because they can't refuse you coverage. They can't hold your health over you or anything and say that you can't sign up for it. Or, you know, if you have a pre-existing condition of heart disease or cancer or whatever, they can't prevent you from purchasing one of those policies. This is kind of the chart that's online for Medicare supplements. So it kind of gives you the insurance at a glance. So you'll notice that Medicare supplements, of course, are named A, B, C, D, just like Medicare. So if it isn't confusing enough to have A, B, C, D Medicare, now you have supplements with the same letters for the different policies. For years, we always called Plan F, which has a little star by it, the Cadillac policy, because everything was covered. You'd pay your premium each month, and you go to the doctor, the hospital, and you would not have, you know, a lot of bills when you got home. So they stopped selling that at the end of 2019. So the next best thing to a Plan F is a Plan G. So it's exactly the same coverage, except you do pay a deductible on your Part B. And that's that $203 deductible that was listed earlier. So there are different levels of Plan G. You can get just a regular Plan G. You can get one that is like what they call Medicare Select. And that's like an HMO or PPO where you go to a certain doctor or hospital system to use that. They also have high deductible plans. So you pay a certain amount out of pocket before the plan kicks in to cover things. So there's different variations depending on what your health needs are and what you can afford. So for people, when I help people look at what their options are, I take them to the Kansas Insurance Department website. On that website is this little yellow box that says Medicare Supplement Online Comparisons. And you go click on that, that'll take you in and you can enter your zip code, your age, what kind of Medigap plan you're kind of looking at. And then if you're male or female, and if you are a smoker or not, or tobacco user, I should say, or not. That's it. And then you'll get a list of lots of different Medicare supplement comparisons. So also on this website, you can find other links for like dental and stuff too. Next to the comparison tool, this yellow box, is a shopper's guide. And if you're looking for good information, unbiased information, that's worth getting. Okay. So option one is going with the Medigap. Option two would be to go with a Medicare Advantage plan. And how that works is it combines A, B, and D into one little package, kind of like going to McDonald's or your fast food restaurant and getting a Happy Meal or a kids meal, where it's all kind of bundled together. So that's how a Medicare Advantage plan works. The money that you're paying for your Part B goes to that plan in order to, you know, pay for it. So typically Medicare Advantage plans work well for people that are very healthy or that can't afford to purchase a Medigap. So those are the ones that typically pick up a Medicare Advantage plan. Some things to know about Medicare Advantage plans. Most of them are HMOs or PPOs, or a specialty type of plan. So you need to make sure that your doctors in the hospital you want to go to will accept that insurance. It's always good to ask them before you sign up for anything. Medicare Advantage also tends to incorporate drug coverage with it. So that's why you're able to change in and out of it every fall during open enrollment. What else can I tell you? Medigap plans, of course, work really well in, like if you sign up for one, it'll work really super well in the metro area. If you want to go visit your kids in Florida or travel around the country, Medicare Advantage plans do not always travel well. So there are a few, maybe a handful that do, but you need to make sure that you understand all the parameters of that. A couple years ago, they added meals and transportation into Medicare Advantage plans. I've noticed this year they've taken a lot of that out of a lot of plans. And typically what that involved was like meals after you've had surgery, and they would pay for like Meals on Wheels to be delivered to your door. And transportation involves like a trip to the doctor or the hospital or whatever, if you don't have a way to get there. Medicare C does also have a deductible, and that can vary anywhere between, I think the current lowest one is like $3,800 a year to as much as $10,000 a year. So that would be your out-of-pocket max, excuse me, not your deductible. But a lot of plans do have a deductible as part of their coverage. If you go to the doctor, you can expect to pay copays, a specialist, probably a higher copay. And then like if you have any kind of procedural like lab work or something, you would pay co-insurance, where it's kind of like you cost share with the doctor for different services. You may be required to use, like I said, a certain network, or you might have to have a referral if you want to go see a specialist. If you use somebody out of network, you can expect to pay an out of network cost. So yeah, a lot of Medicare Advantage plans do have vision, dental, and hearing. And when you get into the plan details, you can see that typically it's like 2 cleanings at the dentist, maybe some x-rays. If you have to have a cavity filled, a root canal, dentures, whatever, that's going to be on your dime. So they typically might, you might get a little bit of a break, but I would not anticipate that at all. Typically it's, once you're beyond that initial like cleaning stuff each, twice a year, then it's all on you. Vision, you can, if it does offer that, typically same thing there. It's just like an annual exam, maybe a little bit of discount on glasses and such. And then hearing, of course, a check, hearing check. And I think if I remember right, that's annual for hearing typically. If you're someone that wants to work beyond 65, you can delay enrolling in Medicare, without penalty. And there's a way to get around it, and that's what we're going to talk about here. So if you, let's say your spouse is still working and you're under their coverage, then, you don't have to pick up Part B. You could add Part A, because typically for most people, A is free. And you could have Part A act as a secondary coverage for your employer coverage that you're on. But you don't want to pick up Part B until you're ready to separate from your employer and go fully onto Medicare. Sometimes it's always good to check with like your HR people to make sure that, you know, the parts and pieces of Medicare that you are interested in taking are going to be okay with your employer coverage. So let's say you're on your spouse's policy and they're going to work a couple more years and you just want to be on their coverage. You don't have to pick, like I said, pick up Medicare. What would happen would be once your spouse retires, then the HR people will fill out a couple of forms for CMS, which is the Center for Medicare Services, and they'll return those forms to Social Security, or you would return it to them. And what that does is that proves to Social Security that you've had continuous healthcare coverage. And so because you've had continuous coverage and you're getting ready to end your coverage with your employer and then move on to Medicare, you won't incur that penalty. So that's why a lot of people are like, oh, you have to sign up, you have to sign up. Well, yes and no. You know, if you're going to work longer and you have employer coverage, you know, maybe pick up A if you want. Or, you know, wait until you're ready to fully go off of employer coverage and go into Medicare. Typically, when I've sat down and counseled people about, you know, Medicare versus staying on employer coverage, typically you have better and more complete coverage on employer coverage than if you would go onto Medicare. I've had people come in where one spouse takes A and B, and then A, B, and D, and then how does that work? And then, oh, like vision and dental and stuff, then they would be able to continue with their spouse. So you kind of have to look at it as kind of what's going to work best for you. Another thing to note about retiring, if you work beyond age 65 and you have a health savings account, it's okay to continue to contribute to that. And sometimes employers even contribute to it too. So that's good. But let's say you're going to retire at 68. When you're 6 months out from that retirement date of 68, you want to stop your HSA contributions, and you want to ask your employer to stop those contributions too. Because if you don't, the IRS will do a 6-month look back. And when they do that, then if you've been contributing to your HSA all this time, then they will charge you a 6% excise tax penalty. So, you know, and that could add up to a chunk of change for sure. So HSAs are a good thing. Don't get me wrong. They are one of the few ways that you can put away money for retirement to pay for your medical expenses. And of course, you're putting it away pre-tax. So you can use that HSA money to pay for premiums for, you know, long-term care or B&D premiums. The only thing you can't pay for is your supplement premium. But it's a great way to kind of have a little cushion built up for retirement pre-tax. So if you have an HSA, max it out if you can, because it'll save you money in the long run. Let's see what else.
Contributing it. You can't contribute.
Right. And the IRS pub at the bottom is the one that talks about the tax penalty.
So you could keep that in an account, the money
Sure.
you put in.
Yep.
You just can't. But what if you're separated from your employer and you've got all this money in there? Can you move that to a different account of your own? I don't know. That's what,
It's designed to be used for medical expenses. So
right, right,
you don't want to move it anywhere to
right.
another account. You'd want
Say
to
you
tap
had
into
money,
that to pay for it, to pay for your
had a
medical
lot of
expenses.
money in there and then you retire. So what do you do
Mhm.
with that? Then what happened?
Just stay
So
home.
yeah, then you just take the money out of there as you need to pay for medical expenses, that are approved. You could use it for
Yeah.
eyeglasses and dental and all that kind of stuff. So
Yeah.
yeah.
But with a lot of employers or with mine, I think you had to use it or you could only keep so much in there. By the end of the
Okay.
year, you could only have, if it's $600 or carry over
Right.
1,000 or whatever. So
Right.
depends on
That's
the employer.
different. That's an FSA, a flexible
Oh.
spending account.
Oh,
HSAs are typically associated with like employer coverage that
Okay.
has the high deductible plan.
okay. That's
Yeah.
what we had that flex. There was a flex. So an HSA is.
Yeah. Yeah.
I don't know what you can get.
So yeah, that's one thing. I keep trying to up the amount I keep putting in my HSA every year so that
So can you open your own health savings account outside of your employer?
not that I'm aware of. I've not heard of anyone doing that.
So if they don't
So-
offer that, you just can't do
Right.
it.
Right. So if they don't offer it, then you're just kind of out of luck. But let's say like, your spouse is working and the other spouse is retired, the working spouse can keep contributing
Right.
to that HSA as long as they're working. So,
Right.
yeah.
Yeah.
So the HSA doesn't like expire like the FS.
No,
Flex,
No.
yeah. See.
that's
where I was
kind of the
confused.
cool thing about it. There's not an
Yeah.
expiration date or a date when you have to have it spin down, to a certain level or anything.
Do you know what the max is, or is that just depend on?
The
what you-
max that you can sink into it per year is around, I want to say around 6,000 or more. So, I mean, you can sink quite a bit of money in it each year. So,
So that would have been good to start like 20 years ago.
yeah, if they only had them 20 years ago, but
Yeah,
they've
I
only
know.
been around a few years ever since they came up with the high deductible health plans. That's when HSAs came to be. So, anyway,
Okay.
Thanks.
yeah. So some tips and cautions. Of course, shop carefully before you buy anything. Don't buy more policies than you need. Now, I've run into people that have an Advantage plan and a Medigap. You don't want both of them. And in fact, they don't even work well with each other. So you want one or the other. So don't buy more than you need. Definitely when you're looking at a Medigap, look at pre-existing conditions or exclusions or waiting periods. Sometimes they'll do that if someone's had cancer or something. I've heard of that happening. Don't cancel your Medigap policy or an Advantage policy or any kind of policy until you've got something else lined up to take its place, because you don't want to drop something until you know for sure you've got something that'll cover it. Of course, Medigaps and supplements, they don't cover everything, but they do cover quite a bit. So most people that I know on Medigaps and supplements don't have a lot of out-of-pocket expenses. One thing I failed to tell you earlier is, no matter which Medigap supplement policy you go with, so let's say you're choosing a Plan G, it does not matter which company you choose. And there's probably 40 or 50 names on a list. Out of that huge list of companies, the coverage all has to be the same. So whether you pay $2,500 a year or $1,500 a year for a Medigap policy, it's the same coverage. So why would you spend another grand every year for the same thing? So be aware of that. That's probably one issue that people tend to overspend on, is they go with the company that they know versus going with the policy choosing it based on policy and price. So, and if for any reason that company would go out of business or get into trouble with Medicare or the Kansas Insurance Department, you would be granted a special enrollment period to move to a new plan. So yeah, there's, you know, it's just kind of one of those things when it comes time to look at that. Definitely make sure you've kind of studied it and know what you're getting into. What else? Be sure you know, I know a lot of people work with like their insurance agents or Medicare broker. Be sure that you trust that person. They get compensated for each policy they sell. It doesn't cost you anymore, but they may steer you one way or another without you even realizing it. So be sure that you have a trustworthy agent or company. There are some creepy people out there, as I like to say, that aren't always on the up and up. So do take your time, and yeah, once you decide, complete the application, be sure you fill it out carefully, and then don't pay cash for anything if you do get a receipt, for sure. So there are some other options for healthcare coverage in retirement. Some companies, there are still a few, at least in our area, that do offer retiree health plans. It's worth checking into and comparing that to what it would cost to be on Medicare. So I always say check them out carefully and before you make your decision. Some people like to retire early, and I've heard of that happening quite frequently, and they'll go on to Cobra. Cobra can be very expensive, so beware of that. FEHB, Federal Employee Health Benefits. I like to say they're like gold because the federal health benefits really cover well. And, they don't have a lot of out-of-pocket costs for either drugs or medical things. So hang on to those. If you are a veteran, please check with the VA and see what your benefits are. There are many veterans, there's probably only a quarter of them that qualify for special benefits that don't even take them. So please check with them. Also the VA, I know we have one in Missouri in downtown Kansas City area. We have one in Leavenworth. They've started opening up these little pop-up, well, it's not a pop-up, but they're just small little clinics. There's one in Shawnee now, there's one in Lenexa. So those are starting to pop up and be available for people to do, like, health checkups and what have you. So it's kind of cool that they're expanding that and helping veterans in that manner. For people, either yourself or others that qualify, they do have a program called Extra Help. And the income guidelines are listed there. Even if you're just above that guideline, or you still have property or whatever, it is highly recommended that you go ahead and apply for Extra Help. And you can do that through Social Security to see if you qualify for getting a break on your premiums and your drug coverage, and drugs. So it's worth checking into. This is another highly underutilized program. So if you know someone that could qualify, please encourage them to apply. Medicare.gov, I would highly recommend once you do go onto Medicare that you set up an account online. They just beefed up their security a couple years ago, and it's a great way to go online, look at your EOB, your explanation of benefits. You can look at, your monthly statements. You can look at drug coverage options every year. So that's where people will be going to look at what Part D plan they want to choose. If you have any issues with Medicare or any parts or pieces of Medicare, you can go online and file an appeal, and, you know, hopefully get some action. We just had a new lady that was hired in at the area agency in Ottawa that was a former Medicare CMS person. So she understands how, you know, taking things up the food chain to get them corrected is so important. So it's a great source of assistance if we need to call on her to help out. Vision and dental. So, you know, Medicare, of course, currently doesn't provide anything. This is a snapshot of the Kansas Insurance Commissioner's website. And under the health insurance tab, there is a couple of tabs. There's one for dental insurance right there in the middle, and then down a little ways is individual vision. So you can actually purchase individual plans for dental or vision. There's probably, I don't know, 30 or 40 dental companies that are licensed to sell in Kansas. The vision, not so many. I think there's maybe 10 or 12. So there are options, and there are companies that will sell you an individual policy if you so choose. Some resources, of course, Medicare.gov, socialsecurity.gov. Be sure it says .gov at the end, otherwise you'll get taken to some crazy place. The direct line in Lenexa, that's that 877 number. I would pencil that in, or if you need me to send you a copy of that, I'm happy to do that. Or if you want copies of slides, I can do that too. Because that's a great number to have, so you don't have to go through the national 1-800 number. You can directly call our local office. The Kansas Insurance Department, ksinsurance.org. They are, if you have any insurance issues, they are wonderful advocates and can really help get to the bottom of problems. The SHICK program in Johnson County is currently run by the East Central Kansas Aging and Disability Center. So that's their number there. We do have a AAA in Johnson County, but this particular program is housed through them. And that's my contact information. So you can email me if you have questions, you can call me. This time of year, I tend to answer email better than the phone. So I'm just kind of warning you. I do get to my phone calls, but not as quickly as I do my email. So it does get kind of busy with open enrollment starting tomorrow. So that kind of wraps it up. So I am going to stop sharing and ask you guys, what kind of questions do you have for me? So